Well, the last few days have been difficult for many Iowans. We have seen tragedies ranging from last weekend's tornadoes to Monday's shooting at East High.
Now you or someone you know may be struggling with their mental health. Local 5's Carson J.S. Reichart spoke with experts on how to take care of yourself and others in these difficult times.
From Madison County to the Des Moines Metro, Iowans haven't had it easy lately. Houses destroyed, lives tragically cut short. And if any of this seems overwhelming, experts I spoke to say
that's very understandable. It's actually normal.
Karen Hyatt, an emergency mental health specialist, told me that the cumulative effects of recent tragedies can stack on top of more everyday concerns, like the economy. So when things get hard, the weight can become overwhelming fast.
Those are everyday stressors, unfortunately, for a lot of people. And so anything on top of that just shuts people down.
One group that can have extra trouble carrying that weight: children. Nyla Mowry, a school counselor with Des Moines Public Schools, told me that she's seen more kids struggling with things like anxiety and depression over the past few days.
I've had students who will tell me, sorry for wasting your time after a conversation such as suicidal ideation.
Mowry told me that one of the reasons kids are hit so hard by tragedies is that they often don't have the same healthy ways to cope. They might not know how to ask for help, or maybe they can't focus on hobbies with so much on their mind.
They don't have as much exposure to coping skills. They also are sometimes limited on what they are allowed to use for coping skills.
But if anyone is struggling, there are resources available to help. Project Recovery Iowa is one of them. The Iowa DHS program provides free counseling and other mental health services to disaster victims, such as families who lost homes from the Madison County tornadoes.
There's support groups for veterans, for parenting. There's book clubs. There's a whole host of different things you might not expect from a counseling grant.
Well, Carson is joining us now. And Carson, did you learn anything about signs that a person might need some extra help with their mental health?
Yeah, like Hyatt said, it's completely fine to have difficulties. But the advice she gave me, if someone is acting outside of their normal, whatever that might look like for them, that's often a sign that they need some extra help.
And with that, if you see someone who's broken that pattern, what should you do? How can you talk to a friend or a family member if you think they might need help?
Yeah, her big tip: don't start with a negative. Don't say you need help. Ask how their day was, have a casual conversation, and let them set the pace and open up when they feel ready.
Lots of helpful advice, something we all probably need to keep in mind right now, Carson.
More than ever.
All right, thank you.